Hi, Goldie here. We're going to talk about why is it that so many doctors are opting out of Medicare. And one of the main reasons has to do with some of the additional regulatory restrictions placed on them under the new healthcare law. See, one provision in particular actually prohibits doctors from referring their Medicare patients to centers or hospitals that they have an ownership stake in. See, the government's not necessarily concerned with the transparency issues of that, things like that. They're actually trying to prevent this increased usage in using ambulatory surgery centers. See, double dipping or a doctor accepting both a facilities fee as well as a treatment fee is no different than if you look at the auto industry. When your car needs to get fixed, you go to the mechanic performs an estimate, as long as it makes sense. A lot of times you go to that same mechanic and they'll fix your car, even though they may own that shop. Likewise in the health industry, health insurance companies have no problem at all with doctors diagnosing a patient and then if they need a surgical treatment, send them to their surgery center that he or she may have an ownership stake in and treating them. Even though they're going to bill twice and collect twice on the fees as well as on the fees of the center as well as the treatment fees, it's okay because there's already been an agreed to price and the quality is there and in place. It really does not make a difference where you're treated or where your car is fixed as long as the quality is there and the pricing is right. So why is it that government is getting involved in this regard? It's to protect the existing hospitals. See, for most elective procedures, you can actually do them on an outpatient basis at an ambulatory surgery center. And what we're finding is that both the patients and the doctors are much happier in these settings for lots of different reasons. Primarily, they're run much more efficient and can oftentimes be a lot less costly. Here's the issue. Historically, when you have customers flocking to emerging businesses, okay, for lots of reasons, for better efficiency, lower cost, better service, whatever the case may be, and the government intervenes to protect the troubled business, historically, it's the consumer that fails, the consumer that loses. In this case, it's going to be the seniors that are going to lose out. They're not going to have access to the care that they need. And that's just simply not fair. Instead of determining where a patient can and cannot be treated, we need Medicare reform that's going to give better access for patients for care, better treatment solutions, better cost alternatives, and better incentives for physicians to want to accept these patients. That's what we need. We need seniors that can be better off. That's reform we need.